A very good morning to all of you. Myself, Dr. Akanksha. I'm a junior resident from Himalayan Institute of Medical Sciences. I will be talking about when childhood corneal opacity unmasks adult angle closure and unusual bilateral presentation. So my patient was a 44-year-old female presented to the HIMS OPD with chief complaints of whitish opacity in both the eyes since childhood and also diminution of vision in left eye since early childhood, which progressively worsened since the past 4 months. The patient came to us with the main complaints of pain in both eyes and headache since one day. There was no history of any ocular trauma, no history of any ocular surgery. Patient had no history of any chronic systemic illnesses. Now the patient's attendant, which was her brother, gave a vague history of developmental delay in a very vague term that बाकी सबके कंपैरिजन में बहुत लेट अपने माइलस्टोन्स अचीव किए थे. दैट इज बट देयर वाज नो डॉक्यूमेंटल एविडेंस ऑफ टू सपोर्ट दिस. सो द हेड वाज सेंट्रल, the face was bilaterally symmetrical, and I'll be talking about the right eye first. The vision in right eye was 6-9 parts, improving to 6-9, and the IOP by applanation tonometry was 28 mmHg. The anterior segment, the right eye showed conjunctival congestion, and the cornea showed diffuse corneal edema with a paracentral corneal opacity measuring 3×2 mm. Pupillary reaction, it showed RAPD, and the anterior chamber showed ACVH1. Coming to the right eye gonioscopy, it was done by 4-mirror Goldman's mirror. So all the angles were closed and the inferior angle showed pigmented trabecular meshwork. The fundus findings. So the right eye showed a cupping of 0.9:1 with optociliary shunt and also bearing of vessels with bayoneting sign and nasalization of vessels. There was also NRR thinning that was present. Coming to the findings of the right eye.
Did you test your presentation before? Your slides are going back and forth.
So the right eye, there was conjunctival congestion that was present with corneal edema, and also there was an adherent glaucoma that was present measuring 6×4 mm. The pupil was normal with respect to size and normal reacting. The AC was irregular, and it was the AC was irregular. On gonioscopy, the patient showed similar findings in left eye also. The pressures in the right eye was 30 mmHg, and the vision was finger counting at 2 meters. So the fundus showed findings of cupping of 0.5:1, NRR was healthy, and there was no other significant finding. So my provisional diagnosis was right eye nebular corneal opacity with secondary angle closure glaucoma with immature senile cataract, and left eye adherent glaucoma with secondary angle closure with immature senile cataract. Now the patient lost to follow up. She just came to us once, and the measures that we took was both eyes laser PI was done. Patient was continued on topical AGMs, and a short course of topical steroids and cycloplegics were given. Now we formed a provisional diagnosis of Peters anomaly type 1. UBM was not done at this point of time, but since the patient showed a bilateral central corneal opacity with also the corneal adhesions with the iris in the left eye, so yes, it could have been Peters anomaly, and also the patient showed gave a vague history of developmental delay, but there were no other systemic findings, there were no other ocular findings like microcornea or microophthalmos or myopia to strongly support the evidence.